Other interactions that we might see with medications are food interactions. Not just foods, but beverages too. Anything taken by mouth has to go through the liver to be chemically changed before the drug can be used. And so any beverage or food could potentially interfere with a drug. One example is the Did You Know on page 26, where it talks about grapefruit juice. Grapefruit juice, for some reason, unlike the other citrus medications, has the ability to block certain enzymes in the liver, and that can interfere with the metabolism of a lot of different drugs, usually cholesterol and cardiac drugs, but also some HIV drugs that you take for the immune system after transplants and other medications. So you have to really, really be careful when it comes to grapefruit juice or the consumption of grapefruit. For some reason, that it's not like other citrus things. You can still drink like lemonade and orange juice, but the grapefruit contains something that hampers that cytochrome P450 system. Alcohol interactions. Alcohol really does not work well with a lot of drugs. Alcohol can change a drug's availability because it's a carrier drug. It can get it more rapidly into the system when you might not want it that rapidly. It can potentiate sedatives. You can have greater central nervous system suppression, and alcohol over a period of time damages the liver. So if you take it with a drug that also is hard on the liver, you can end up with some severe liver damage. Alcohol and Tylenol taken together consistently can do a lot of damage. Drugs and lab tests. Drugs can change the results of some laboratory test. A lot of women and maybe some men might be familiar with the drug pyridium. It's sold over the counter as urinary tract pain medicine. It turns the urine a really bright red, orangey color, which can interfere with the urinalysis. And a lot of medications can also interfere with internal lab tests, blood draws, and things like that. So that's important to think of. And then we have to consider a situation called chronotherapy. Some meds are more effective at different times of the day. You want to take a sleeping pill at night rather than in the morning. Cholesterol meds, we make the majority of our cholesterol between the hours of, say, 11 p.m. and 2. So you might want to take your cholesterol med at night before you go to sleep. Thyroid medications like Synthroid speed up the metabolism. So you want to take those very early in the morning, usually, well before breakfast on an empty stomach. This is just a little slide that gives some different food and drug interactions. You can look at that a little bit more closely. Other things that can affect drug therapy, it's not one size fits all. And you just have to look at how each individual person is going to respond to drug therapy. Ethnicity and genetic makeup, we already referred to that. Liver or kidney dysfunction, because the liver and the kidneys both play such an important part in metabolism and then excretion. If your liver or kidney function is not really up to code, you're not going to be able to either metabolize medications or excrete them. Also, a number of lifespan considerations, things that are affected by the stage of life that you're in. And we're just going to kind of briefly look at those, but make sure you read those on pages 30 to 32. There are some pediatric considerations when it comes to children, things we have to think about when we're giving children medications. So whether you have a newborn to an adolescent, lots and lots of different considerations. A baby is considered a neonate for the first 30 days of their life, and there can be a huge difference in just, a 1 day old and a 1 month old. At less than 1 month of age, absorption is very different. Babies are born with no to little gastric acid present. They develop it later because they're intended to have a very mild milk-based diet, so they don't need a whole lot of acid to break things down. So that's going to affect absorption. Anything they take PO absorbs more slowly. Once again, on a milk-based diet, you don't want to break that down. You want to digest it slowly and get as many nutrients as you can. Tiny babies tend to have a small muscle mass. They have more body water and less body fat at first, and then as they get older, they put on more fat. You see that just in the first couple months of a baby's life. They start laying down more fat. And their muscles change a little as they move more. The thighs have the largest muscles for IM injection up until about 6 years of age. So up until your child goes for their kindergarten checkup, generally any vaccines or other injections need to go in the thighs. Children, until they're up and really walking and running, they don't build up the muscles of their buttocks until later childhood. And so thighs are where you're going to have the best shot at large enough muscles for IM injections. And even then, of course, you need to adjust the amount of the medication and the size of the needle. Distribution depends on lean to fat body mass ratio. We talked about how some drugs have a greater affinity for adipose tissue, some are absorbed into muscle tissue. So a child's body weight and fat to muscle has a big influence on it. Metabolism, the liver system of a child is immature. They're more likely to have overdoses and toxic effects as babies and small children than somebody older. Children tend to have a higher metabolism. They need more frequent drug dosages. Growth spurts can affect a lot of things, how much food and beverages they need. You know, certain kids, they have this growth spurt and they're like eating everything in sight for a while. And that can affect the amount of medication that they need. And children have fewer drug receptors. For instance, sometimes a pediatric cardiac patient is going to require more of a cardiac drug than maybe his grandfather would, because children have fewer drug receptors, so there are fewer protein structures to initially process that drug. So they need higher doses more frequently than maybe their grandfather would need, because grandpa's got more receptors in a more mature system. Babies and small children tend to have more immature kidney function, and that affects elimination too. You can't give a small child huge amounts of, salt and other minerals. It overwhelms their kidneys and they can get really, really sick. There are a lot of considerations for geriatric drug therapy, and this affects us as nurses because so many nurses now have jobs where they're dealing with the elderly. It's the fastest growing population. And so lots of things that we need to think about when we're giving drugs to the elderly. And I will stop here so we can resume with a new video and talk about that.